Hey guys, welcome to today's episode, and we're so excited. We have Dr. Eric Balcavage, and we are talking all about thyroid. We're talking about functional medicine. We're talking about gut issues and so much more. So everybody welcome. And Dr. Eric, thanks for being here.
Thanks for inviting me to the podcast.
So I know you've written a book called The Thyroid Debacle, and I love the name of that because I will tell you, I feel like there are certain issues, right, that people talk about with the thyroid. And one person says, you're probably low in iodine. And the other person says, no, you've got too much iodine. And they go on other sides. So it really can be a debacle. So let's talk about some things that are controversial, right? Like one person says, you have too much iodine. The other guy says you don't have enough, and what your answer is. So can we talk about that?
Yeah, I guess the first place to start is when we think about hypothyroidism, there's two big camps. In allopathic medicine, there's one camp, and that is that you have hypothyroidism, that the gland can't make thyroid hormone anymore. In functional and integrative medicine, we have a disagreement. In functional medicine, because we like definitive things in functional medicine, which is like kind of an oxymoron in functional medicine because it's never the same thing that creates health issues. And so we have one camp that's everybody's likely iodine deficient, and we have another camp that says everybody is probably iodine overloaded, and the reality is it's probably somewhere in between. Some people probably have iodine deficiencies, other people have immune-driven primary hypothyroidism. And so how do you solve that issue? You can't treat everybody with hypothyroidism the same. You have to assess, is this a person who has an immune-driven thyroid gland disorder, or is this a person who has an iodine deficiency, or is this a person who has potentially both? And the only way to determine that is to assess the individual and not a diagnosis. So I'd say that's a big one. I'd say within the allopathic versus integrative and functional medicine camps, we have a disagreement between what constitutes an assessment of thyroid physiology. And the allopathic model would say that TSH and free T4 are the only two tests, maybe even TSH is the only test that needs to be done to assess thyroid gland and thyroid physiology. And that's not accurate. TSH represents what's happening at the hypothalamus and the pituitary axis and how much thyroid hormone is hitting those two tissues primarily, and does not represent what's happening throughout the whole body. So why would an allopathic physician think that those are the only two tests that might need to be done? And it's because their job is to replace T4 when the thyroid gland can't provide enough anymore. So they don't care about any other values except TSH and T4, and they've been taught that as long as you give appropriate levels of T4, it's going to convert into appropriate levels of T3 inside the cells and tissues. And that's not true. In the functional medicine space, we make an argument that there's more importance, and we need a full thyroid panel, which might include a TSH, a total T4, a total T3, a free T4, a free T3, a reverse T3, T3 uptake, and potentially antibodies. And we think that without those tests, that you can't fully assess thyroid physiology. And I would say, to a large degree, that's true, but not completely true either. Because you could run all those tests and they're all normal, but the person still has a thyroid condition. Because what everybody primarily looks at is what's going on in the bloodstream. Is the gland producing enough thyroid hormone? And is there enough thyroid hormone in the bloodstream? And we assume that as long as there's enough thyroid hormone in the bloodstream, that a person wouldn't have hypothyroid symptoms. But I know that hypothyroid symptoms are caused, and hyperthyroid symptoms are caused by how much T3 is actually hitting the receptors inside the cells. So what's in the blood doesn't necessarily correlate with what's in individual cells and tissues, and they all regulate thyroid hormone differently. So even though the allopathic community would say you only need a TSH and a free T4, the functional medicine or integrative community would tell you need the full thyroid panel, which we look at totals. We should look at the totals and the free. Many clinicians only run the free hormones and don't bother with the total, which I think is ridiculous. But you need to look at the full panel, but you also have to look at the rest of the blood panel. You need to see if the person has inflammatory markers that may be influencing the thyroid panel. You need to look at lipid values to see how the thyroid hormone is regulating the liver and other tissues and supporting lipid physiology. We need to look at blood glucose markers to see if what's happening with glucose regulation, because to regulate glucose, you need a sufficient level of T3 in the cells. So we can't just look at a thyroid panel. We have to look at the rest of somebody's blood work along with their signs and symptoms. Probably another issue is the controversy between lab reference ranges that we see on a lab report and what functional and integrative practitioners have deemed the functional or optimal ranges. Now, the lab ranges are wide, and they're meant to be wide so that you can pick out disease. But a lab value is not meant to be looked at from a high or low perspective. It's meant to be interpreted. And most people aren't interpreting it. So if the TSH value is above 4.5, it's out of the lab reference range. But that doesn't mean that it's abnormal. It may be totally appropriate. We have to determine what's going on with the rest of the person's thyroid panel, the rest of their labs, to determine if that's an appropriate response for that individual. As an example, that person has TSH over 4.5. Yes, it's lab high, but if their free T4 is good and their free T3 is low, then that T4 or that TSH may be elevated to help increase thyroid hormone production of T3 to support the low value. If the person had iodine deficiency, that TSH may be appropriate to help pull iodine into the thyroid gland to support production. So we have to interpret labs, not just read them for high or low. But that doesn't mean functional medicine or integrative medicine is doing the better. We make up arbitrary numbers as to what we think is a better range. We say, TSH should be between 1 and 2 because that's closer to the midline. Therefore, that's where it should be. But lab values are not the problem. Lab values tell us the story. So again, in that same model, somebody might say, well, the person has hypothyroid symptoms and their TSH is above 2.4 and their T3 is low. Therefore, they have hypothyroidism and I need to give them T3. And that's ridiculous. The TSH might be up a little bit because it's January. And in January, TSH levels tend to be higher. The TSH levels could be up a little bit because there's a little bit of iodine deficiency. It could be up a little bit and T3 down a little bit because the person just worked out the day before, or they were sick, or there's inflammation. So we get this idea that we can optimize the blood values and that optimizes somebody's health. And that results in significant over-medication in this population of people. There's a paper that came out, I think it's 2022 or 2023, which talks about the overprescription of thyroid medication. And it's believed that somewhere between 60 and 90% of the people on thyroid medication have been prescribed it inappropriately. And the integrative and functional medicine communities are to blame for most of that. And that's sad to say because it's the community I work with. These are my peers. And I understand why they're trying to do it. They're trying, their belief is that they optimize T3 when the person has lower T3 than they assume is optimal, that if they put more T3 into the bloodstream, it will optimize the patient and it will raise T3. It may lower cholesterol. It may reduce some symptoms, but it's going to probably be a temporary shift if the reduced T4 to T3 conversion was an adaptive change due to some type of inflammatory response. And providing that thyroid medication, especially T3 too early, may actually create a glandular problem when there isn't one, because it'll saturate the pituitary, drop TSH, and now reduce thyroid gland production. So in the world of of people, especially people struggling with thyroid physiology, we have to stop trying to manage the numbers and assume that restores health in both the allopathic and the integrative and functional community. But these are like three big problems and challenges that somebody who's struggling with what they believe or what they think is a thyroid condition may really get confused, because you hear one side that says this, you hear another side that gives a totally different answer to some of these questions, and probably both of them are incorrect.
I don't know about you guys, but I am stressed. And if you're feeling overwhelmed this holiday season, then I get it. With all the family get-togethers, it is just a relentless source of stress. But anyway, there is something that I've got called Stress Guardian, and it's actually made by Bioptimizers, the people who make the magnesium breakthrough, which I love, love, love. But anyway, they are literally made this new product. It has 14 adaptogenic herbs, and it just regulates your stress. I just actually took some right this second, and it's awesome. If you go to stressguardian.com/wasteaway and put in waste away for 10% off your first order, it's stressguardian.com/wasteaway. Go there now. Okay, so if you're listening to this and he went through the complete set of thyroid lab tests pretty quickly, just go to chantelrayway.com/bloodwork. I have written out my functional medicine doctor that I see gave me a list, and he basically, the TSH, the free T3, free T4, reverse T3, total T3, total T4, T3 uptake, and then the antibodies test. So those are what he had suggested that I take when I had some thyroid issues, and he had asked for me to do that. And I put on there what he had suggested that, again, like you had suggested earlier, people who are regular doctors, a lot of times their window of what they think is normal is a lot broader than what a functional medicine doctor would be. A functional medicine doctor, their window is a little bit more shallow. And so I wrote down what he said are the numbers that he suggests for his folks. But what I'm hearing you say is that even some of the functional medicine doctors who do all of these different things and all, even if they do this full panel, that sometimes what you're saying is maybe your inflammation levels when you took the blood work test were super, super high, and people are still not treating it properly, even with this full panel. Is that what you're saying?
Well, yeah, you can't assess somebody's thyroid physiology by just looking at their thyroid panel. Unless your goal is to provide medication. If your goal is to provide medication to raise T4 or to raise T3, sure, that's all you need. But is that actually functional medicine? I would tell you it's not. There's a reason. If T4 is normal and T3 and free T3 is low, giving you T3 is not the answer. That changes the value, but that is not functional medicine. Functional medicine would be saying, why is the T3 not being produced the way it should? Why is T4 not converting to T3? And so we've bastardized functional medicine to something that's just glorified, greenwashed allopathic medicine. So, and no offense to your doc, I used to do the same thing, but if you just look at those panels and say, well, your T3 is not between 3 and 4, therefore you have a thyroid problem and prescribe medication, you may be actually be the cause of somebody's glandular hypothyroid condition. And so the other problem is that people are assuming that the person who comes in, who's tired, fatigued, doesn't feel good, has all this hypothyroid symptoms, looks at their thyroid panel and sees a lower T3 or free T3 and an elevated reverse T3, and assumes that if they just give T3 and they change those, manipulate those values, that the person's going to return to normal health. But that person isn't in homeostasis. If the person was in homeostasis and they'd had a dysfunction that prevented them from optimally converting T4 to T3, then yes, that might restore their health. But if they're in an allostatic state, which is an excessive stress state, why would we think that giving them more thyroid medication that their body didn't want to make in the first place would actually make them healthier?
So then let's talk about this. So would you say, because I know for me personally, I take a few supplements that I believe is really good for a T3 conversion. And so it helps the T4, convert to T3. And so I would say, like, if I'm taking some selenium, some iodine, some vitamin A, those really help with my thyroid. Like, I can literally, like, if I take that supplement, I can definitely feel that I'm getting, like, I just don't feel as tired. I just feel like my thyroid's functioning up, at its peak. So would you say that's part of the reason, is that people don't have the nutrients that they need? They're lacking in selenium, they're lacking in vitamin A, they're lacking in some of these things that the body can't convert the T4 to T3?
The iodine is not helping you convert T4 to T3.
Okay.
But iodine is needed by the thyroid gland plus a whole bunch of other tissues. So if you have an iodine deficiency, you should be checking to see if you have an iodine deficiency before we take thyroid medication. Taking thyroid medication doesn't fix an iodine deficiency, but you might have an iodine deficiency, and therefore the iodine helps you feel and function better because it's supporting the immune system, the thyroid, and a whole bunch of other tissues. And if you take selenium, there's a lot of papers and a lot of posts that talk about selenium is needed to help with conversion and to help make thyroid hormone and prevent oxidative damage. And selenium is a critical component. But when they look at a lot of patients and to see if they have selenium deficiency, especially in a hypothyroid state, they find that selenium doesn't necessarily improve somebody's hypothyroid state or that conversion of T4 to T3 globally. Now, it might help an individual, but that isn't the primary cause that most people have a reduced conversion of T4 to T3. The last one you said was vitamin A. And I do think in today's world where everybody's over-supplementing with the copious amounts of vitamin D, oral supplementation, that may have an impact of reducing vitamin A absorption in the body. There's very few foods that have vitamin D in them. We're not meant to get vitamin D from most of our food. Definitely not meant to be getting 5,000 IUs a day from supplementation. And so excessive doses of vitamin D may actually reduce vitamin A absorption. And if you reduce vitamin A absorption, then that is going to have a negative effect on cellular signaling, especially with thyroid signaling inside the cells. So taking those things could be beneficial. But when somebody says my T4 is good, my T3 is low, my reverse T3 is elevated, I'm going to take T3 to help with conversion, you already have enough selenium to help with T4 to T3 conversion. The deiodinase 3 enzyme that converts T4 to reverse T3 requires selenium as well. So if you had a true selenium deficiency, you wouldn't have high levels of reverse T3 in most cases because you wouldn't be able to deactivate it. So all the deiodinases use selenium. We need selenium to make thyroid hormone. We need selenium to help support the conversions. But when I hear people say, hey, the reason you're not converting is because you need selenium, then all you have to do is look at their reverse T3 and it's elevated. So that can't be the case. Okay. And I've done enough micronutrient studies to see that, hey, the people that say, well, you need CoQ10 to have healthy mitochondrial function. If they're hypothyroid, they already have high CoQ10 because they can't use it. They may already have sufficient levels of selenium. And I've run a lot of those tests. So I don't think that's the underlying factor. But I wouldn't argue if you said, hey, I feel better doing it. That's great. But if you have a reduced T4 to T3 conversion, it's usually secondary to some type of cell stress inflammatory mechanism. And the other thing we have to be careful is what range are you, your doctor, whoever, deciding is the optimal range? Are they saying it's 3 to 4, it's 4 to 5? Like, I'd love to see the literature that backs up what the range is. that somebody justifies. Many times, especially as we get older, the T3 levels tend to be a little bit lower. TSH levels tend to be higher, and that's normal. Values can change seasonally. So I think we just have to be careful in what we say many times. But I just did this right before lunch. I had a patient who said, hey, I got diagnosed with hypothyroidism, and they told me what their labs were. Their TSH was 4.99. Their free T4 was like 1.3. And their free T3 was like 2.8. And they got diagnosed with hypothyroidism. I'm like, you don't have hypothyroidism. You might be developing it, but your conversion is pretty good. We don't know what the totals are, but there's enough T4 to convert to T3. So if you have enough T4 to convert to T3, that elevated TSH may be result of your age, the season that you took it, and the fact that there's maybe lower iodine, and maybe that there is an inflammatory mechanism going on. The labs that she presented were 2 years ago, and immediately upon seeing an integrative practitioner, they put her on 60 milligrams of Armor, which then created heart palpitations, and her TSH went to 0.7, her 0.07, her T4 dropped, her T3 tended to be a little bit higher, but all her numbers got worse. And then she's been on a 2-year escapade of trying to find the magic dose. That was somebody who doesn't understand thyroid physiology, trying to manipulate lab values and optimize lab values before they fully understood what was going on with the client.
Did you know that you can get all 4 of the books that I wrote, Waste Away, Fasting to Freedom, One Meal into Tasting, and Freedom from Food? You can buy all 4 books and get the ebook for free. Go right now to chantelrayway.com, or you can go to Amazon. Also, I just wrote a brand new book called How to Delegate Everything But Sex. If you are stressed out and are tired of doing everything on your own, go check out Delegate Everything But Sex, and there's all kinds of freebies on the site. So what are you doing that is helping people? So like if someone comes to you and they say, hey, my labs are coming back, quote, normal. But I'm still exhausted. I'm super tired. What tests are you going to do, and what are you going to try to do to get them to feel better?
So at the end of the day, if you're asking me if they had a totally normal thyroid panel, right? All the values let's even use your doctor's optimal ranges. Let's say all the values are within the optimal range, right? Mm-hmm. And the conversion of free T3 to free T4, or T4 to T3, and I look at the free T3 to free T4 ratio. If that ratio is within 0.31 to 0.34, then they don't need thyroid medication. They have a different reason for why they're tired and why they have symptoms. Now, they have enough thyroid hormone. More is not going to fix the situation. Obviously, there's enough in the blood. The TSH is good. Now we have to look at the rest of their labs, their health history, their health timeline for what's creating a fatigue issue for that individual. Could it be inflammatory mechanisms? Could it be that they have a lot of emotional stress? Could it be disrupted sleep? Could they have poor breathing patterns? Could they have blood sugar dysregulation? Could they have some type of an anemia pattern going on? I mean, you have to go through their labs, their health history, and health timeline. But I would argue that if somebody showed up and had chronic tiredness and fatigue, they're not going to have a perfectly normal or even optimal thyroid panel. But that doesn't mean we give them thyroid medication because it's not optimal. What we would do is we'd say, okay, this is a person who has a reduced conversion of T4 to T3, maybe or maybe not an elevated reverse T3. Is this a person who actually has a glandular issue, or do they have a tissue issue at the moment? If they have a glandular issue, do we have to then determine, is this a person who has an iodine deficiency pattern, or is this a person who has immune inflammatory cell stress pattern? If they have an immune inflammatory cell stress mechanism going on, that's why their T4 to T3 is reduced. That's probably what's driving the thyroiditis and the gland to be damaged, whether they have TPO or thyroglobulin antibodies or not. And then we have to look at their health history, health timeline, the rest of their labs, and say, what are the most likely things contributing to an excessive cell stress state? And what do we need to do to identify them, reduce them, or eliminate them so that we can shift the body's regulation back from this allostatic cell danger response to a more homeostatic response.
And what would some of those be? Like, would you say like some of those other issues, would you say they're autoimmune? Is it gut issues? What are some of the other top contributors that could also be affecting the thyroid?
Emotional stress, trauma, or real or perceived stress, disrupted sleep patterns, disrupted breathing patterns, too much or too little exercise without recovery, bad habits, poor diet, too much alcohol. You could have organisms, systemic infections, gut infections, toxicity, and usually it's not one of those things, but an accumulation of those things over time. Mm-hmm. And that's what functional medicine's about. Every person's their own unique Rubik's Cube. And the problem in allopathic medicine is they wait till disease is present to treat, because that's what their toolbox provides them, is a surgery or a drug to treat the disease. They're not trained on how to determine, to see dysfunction and address the root cause of it. That's not their training. Functional medicine training is to look for the drivers which creating that excessive stress load. But we've had so many people flood into integrative and functional medicine that we've changed what functional medicine is. We're using supplements and protocols to manage things and thinking that's better than drugs. In many cases, that may not be better than drugs. And so what I do is what I think functional medicine is. Is this person in an excessive stress state? Does this person have an inflammatory issue going on? Do they have an infection issue going on? Are they in a lot of trauma? What's contributing to that stress load? And that's what we need to change. It would be like, I guess the best analogy would be is, if you had a fever because you had infection, is the fever the problem? Well, are you uncomfortable because you have a fever?
Yes.
So if I gave you a fever, if I gave you something to suppress the fever, did I make you feel better in the moment?
Yes.
Did I help your immune system deal with the infection, or did I reduce your immune system's ability to fight the infection?
Reduce it.
Okay. So if you have an infection and the or inflammation going on because of an infection, and the natural response in that situation is to downregulate the cell function, downregulate mitochondrial function, slow down cell metabolism. And to do that, we need a decreased conversion of T4 to T3. And the patient doesn't feel good. Should we try and ramp up their T3 to temporarily make them feel better, but at the same time actually make that work against what the body's trying to do? Think about this for a second. We talk about mitochondrial function all the time, right? Everybody's got mitochondrial dysfunction. Does giving somebody more thyroid hormone if they have mitochondrial dysfunction or a downregulated mitochondria make sense?
No.
No, because when the mitochondria of a cell sense danger, what they do is they stiffen the cell membrane of the cell. Okay? And then they downregulate the mitochondria on purpose. So by stiffening the cell membrane, that reduces glucose transport and other nutrients coming into the cell. That sounds bad, right? Now I've got glucose resistance. My fasting glucose is going up. But why is the mitochondria driving that? Because if there's a threat inside the cell that the mitochondria senses, if you brought more nutrients into the cell, the threat gets to use them, right? So the natural defense of the cell is to decrease nutrients coming in and start the autophagy inside the cell to start cleaning up the debris and looking for the problem. The other reason the mitochondria downregulates is because when you have a mitochondria running at full tilt, it produces some oxidative stress. Now, the cell makes antioxidants to support that oxidative stress. However, if the cell also has to increase free radicals to deal with the threat inside of the cell as a defense mechanism, and I have free radicals from the immune response and free radicals from a full tilt mitochondria, you'll quickly overwhelm the antioxidant capacity of the cell because there's less nutrients coming into the cell. and you would actually create oxidative damage to the cell and potentially cell death. So what does the body do? Those stress and inflammatory triggers inside the cell reduce T4 to T3 conversion, increase T4 to reverse T3 conversion, reduce T3 to T2 to slow down the metabolism and then help create a better balance between the free radicals and the antioxidants. So a lot of this stuff is just natural adaptive response. Now, if that happens for extended periods of time, we can get really sick and really ill. That means we shouldn't totally pretend like it's not happening. But to rush in there with more thyroid hormone in that situation could actually increase mitochondrial density and increase oxidative stress and make the person sicker in the long run. And the excess thyroid hormone, especially T4, that we force into the circulation, not only does it upregulate the sympathetic nervous system, create more oxidative stress, more brain fog, more anxiety, more insomnia, but T4 has the ability to bind to receptors on the outside of cells and cause sick cells to replicate. We call that cancer. And so if you look at the study from 2019 that looked at all forms of cancer in people, I think it was somewhere like 5 to 10 years after starting thyroid medication, there's a greater incidence of the vast majority of cancers in people on thyroid medication than people who never received it.
Oh, wow.
So there's a number of papers that have come out in the last year or so talking about how hypothyroidism is a protective response, which is what my book, The Thyroid Debacle, that I wrote a couple of years ago, is arguing it for. Is that instead of rushing in and thinking we're fixing people, we need to ask the better question. What's causing the hypothyroidism and how do we reduce the excessive cell stress, which then allows better T4 to T3 conversion naturally and allows for the thyroid gland to recover on its own. And most of the patients that I see have to reduce or eliminate their thyroid medication over time because their thyroid physiology works better and their thyroid gland is recovered.
Guys, I just want to interrupt for just a second, and I want you to hear Paul Saladino talk about why liver is so important. And if you don't like liver, we have another option for you.
Your ancestors were eating liver. And the reason that this sort of wisdom has been passed down is because liver is very nutritious. It's basically nature's multivitamin. If you look at the nutrients in meat, they're great. You've got zinc, you got B6, you got B12, you got some K2. But if you look at liver, it really complements what's in muscle meat. And there are many unique nutrients found in organs, specifically liver as a powerhouse of these, that are difficult to obtain outside of liver. Like meat and organs are like peanut butter and jelly. They just go together. They're supposed to be eaten together. The easiest way to eat liver is just to do it raw. If you don't want to eat liver raw, you can cook it. But the reason that I like to do it raw is because there are unique nutrients in liver that are probably somewhat degraded when you cook the liver.
This really is like the most nutrient-rich supplements that you can find, and they are amazing. I have tried them. I absolutely love them. So just go to heartandsoil.co, use the coupon code, and save you some money there.
And I want you guys to know that if you go in the show notes, you can see he's got a free ebook. It's called Learn the 3 Hidden Reasons Why Thyroid Replacement Isn't Helping You or maybe even making you feel worse. So go into the show notes and look at that. And I would say, have you really helped? It sounds like you've helped a lot of people gradually come off their thyroid medicine and not even have to be on it. Is that true?
Absolutely.
Mm-hmm. Awesome.
Most people are over medicated to begin with. So, I mean, it's easy to do. And most people, their thyroid glands can recover if they're not over medicating and if they're addressing the root issues.
I love it. Well, thank you so much for being with us. Tell listeners where they can find you and where they can follow you.
My website is rejuvagencenter.com. I have a podcast called Thyroid Answers Podcast. I probably make a lot of educational posts on social media, primarily, I guess, Instagram. I think that's where my team puts most of the stuff. And I have a book out called The Thyroid Debacle. You can buy on Amazon or wherever you buy your favorite books, I guess.
I love it. Well, you guys stay tuned. We've got another episode coming up in just a few. Bye-bye for now.